My name is Ray Cool. I'm president of PBSI. Welcome to all who've joined for today's webinar, Dragon Medical, Key Features that Matter in Clinical Use. Several of you who've registered and have joined for today's webinar already use a version of Dragon. Some it's a former version, some it's a non-medical version, and some use a current medical version. Some of you, this may be your first exposure to Dragon Medical. You're in for a treat, particularly if you've used a previous version or you use a non-medical version. The features that exist and the way they work in Dragon Medical are fantastic. So as president of a technology company, I'm not a technician, but I will say in 30 years of technology work, this is my single favorite product. It works every time, it works beautifully. Our goal is to help you use it effectively. So our goal today is not to sell anything. This is free information to help folks who use Dragon use it more effectively. So our agenda will be a demonstration where we'll cover the key features that we have found to be most beneficial for clinical use and some settings that don't come out of the box this way, but a little tweak, very easy to do, of several things will help improve productivity. So, and then we'll talk just briefly at the end about implementing and cost. So some of you know PBSI very well. You've worked with us for years. Some this may be your first exposure. So clarification, Nuance is the manufacturer of Dragon and all of its variations, including Dragon Medical. They're a publicly traded company. Their technology is used under the surface in many products that you know and love from companies like Google or Apple or others. So the technology that Nuance brings to the table is fantastic, really works. PBSI's role in this, we're an authorized reseller of Dragon Medical, by far the largest in Ohio, Kentucky, and Indiana. And our goal is to help clients use, whether you use any EHR or whether you don't use an EHR at all, help you include this and make it a part of your clinical documentation process. And we find time after time success. So our goal is to help implement and improve use, which includes on-site training, phone support, number of ways, template assistance that we can help. So, okay, on to demonstration. Now on your screen, there are a couple of pictures. I'm going to point out first on the right-hand side is a PowerMic. This PowerMic is available only with Dragon Medical, and 90-something% of all Dragon Medical users use this PowerMic. The reason is, if you hold it in your left hand, of course, depends on what your preference is. I have a headset mic on where I'm speaking to you for this webinar. When I start using Dragon, I'll pick up this PowerMic in my left hand, leaving my right hand free to use my mouse or type on the keyboard or anything I want while I'm interacting possibly with an EHR while I'm speaking. So the big button in the center is on and off. It comes out of the box as press and hold to talk and then let it up when you want to stop talking. I don't like it that way. I prefer press it once to turn it on, press it once to turn it off. So, and there are a couple of other buttons that we set for you. Next field, previous field, tab key, back tab key, so you can navigate within whether it's Outlook or your EHR. So the microphone, very, very important part of the dictation process. You can use virtually any other microphone on earth, including Dragon has the ability to use this iPhone or an Android as your microphone, where instead of dictating and storing text on your iPhone, you're actually dictating directly into your EHR or some other device using your iPhone as your microphone. So many choices and many microphones work well. The reason that this PowerMic is the preeminent microphone really has to do with freeing the hands and the quality of the mic. So with that said, let's look at some features. So I want to talk about some things that we find many folks don't use or don't use effectively. So the first I'm going to talk about is templates. I'm going to go straight to a demonstration here, and I could be going into any Windows program. I happen to be going into PBSI's EHR, and I'm going to go to a place in the progress note where I want to dictate. So the way Dragon works, it is a Windows program that operates that wherever I am in another Windows program, like EHR or Word or Outlook, wherever the cursor is, which right now sits in this box, when I turn my microphone on and begin speaking, it turns it into text. So one other thing, and then I'll start, lower right-hand corner, you see this little picture. If you haven't maximized the window for GoToMeeting on your screen, you might want to do that because this text will appear pretty small, but this little red box is a picture of a microphone sitting on its side. I'm about to pick up my microphone in my left hand. When I push the button, you'll see that little box in the lower right turn green. That means that Dragon, instead of ignoring me, is listening to me, and I'm going to do that now. Patient is a 15-year-old male who presents with lower back pain, period. Patient's BP was 210/180 when arriving at the office, period. We immediately contacted Dr. Smith's office, commenter sending the patient immediately for a cardiology consult, period, new paragraph. So here in this case, I spoke quickly, whatever, and you see the understanding the patient, that's not exactly what I said. So now I'm going to use the select command. I'm going to get to using a template here in a second, but you'll see that the Dragon understands me wonderfully and quickly, but when it doesn't, I think I said, I forget what I said, we're going to send the patient. So I'm going to use the select command now, and the timing of what I do is important. Here I go. Select understanding the, and we sent the. So what I did is I used my voice to select a set of text. I could have used my mouse like this. I could select, and then I could speak over top of that, but the principle's the same. I select it with my mouse or I select it with my voice in any Windows program. Whatever, when this is highlighted, whatever I type or speak next replaces that text. That's the way the select command works. So more about that in a moment. Now I'm going to use a template. Normal hypertension. Scratch that. Normal hypertension. So this is a template that the system called in where I had this group of text associated with that command. I'll do a couple others. Normal consent. New paragraph. Recommend surgery. Okay, so this recommends surgery, again, just an example of a block of text that I've given a name and I've called it a template or a shortcut. And the idea is there are many examples like this. These may not be good examples in your specialty where the formatting and all of this is very repetitive for you. So obviously the key is clinically to have these templates that are repetitive. Now, most of you listening to me use an EHR. Understand that there are some things you're going to do by clicking. You'll continue to do this by clicking inside of your EHR. The point here is to get to the places where you're either inefficiently going from screen to screen and you want to cut that down, or you're typing. Typing is a horrible way to waste time, and Dragon's a great solution. So now I'm going to get rid of some of this, just leave more room on my screen, and I'm going to go on to a couple other things. So let's return to PowerPoint just to make this list complete. So we looked at using the select command, and I'll give you a bit more information now. When you use the select command, if you're somebody who uses Dragon Medical and you found this to be frustrating, it's one of the things early on we find that has the greatest possibility of frustration. The select command depends on timing. It's really simple. The two things are select a phrase, not a word, and decide what to select before you use it. So I'm going to go demonstrate that select command, and then I'm going to demonstrate and make that a shortcut. So what I mean by the select command, so let's say that I looked in this paragraph and I saw having side effects. I wanted to change that to something else. Now, I'm going to use this incorrectly first, and I'll give you an example of how frustration can occur. Select having side effects. So undo that. The point is it didn't really know exactly what to do, and the reason is there was too long of a pause between my use of the word select. So if I decide I want to pick this text, okay, so now I know what I'm going to say, and I'm going to do it this way. Select having side effects, having significant problems resulting from use of, and so forth. So whatever you speak replaces that text. So the idea is if you want to select stop Darvocet, then you'd say select stop Darvocet. So just as if used in a sentence, very little pause between the select command. So for those of you who've said, I've given up with the select command, it never works, it always does something unintended, it is really easy to make it work well. Just understand those couple of things. Now, make that a shortcut, what this is about. Many folks who are accustomed to dictating rely on a transcriptionist or somebody else in the clinical staff to fill in the blanks and take care of the details, which is perfectly fine. Dragon permits you, however, to really become involved in your own process where you can speed up and reduce waiting for transcription or other staff by learning how to do something simple like this. So I'm going to read some text which is not any great, but the idea here is I would be speaking something that after I speak it, I say, you know what, I'm going to say, I've said that same thing before, I'm going to say that same thing again, I want to save that. Patient is a 15-year-old female who presents with lower back pain, period. We evaluated the patient's condition and found problems between S1 and S2 and are recommending surgical follow-up, period. Okay, so this may be not a good example, but now I'm going to do a little, I think, all right, I've said the same thing a bunch of times except for there's some variables here. So I'm going to select this 15-year-old female part, and I'm going to say instead of that, we'll put brackets, just a couple of square brackets inside of there. And you'll see what I'm going to do this with in a second. Who presents with, and let's say this is a lower back pain template. So I'll leave that there and maybe replace this. Hopefully you get the idea. You can put variables, that's a left and a right bracket together. And so now I'm going to select this and I'm going to use this command, make that a shortcut. So the idea is not something this short. You've just done a paragraph and a half or 2 paragraphs worth of dictation. You say, yep, I'd like to save that for next time. So here's the command, I'm going to use it now. Make that a shortcut. So what it did is it popped, anything that was selected, it popped up into the content area, and this could be formatted so you could have a SOAP note template with a subject and objective, underline and bold and so forth. But it comes to this place where I'm going to give this command a name. So I'm going to call this normal back pain. Normal back pain. Click Save. So I could have typed in the name of my template, but I spoke it with my voice. And so now, how does that template actually get used? First, I'm going to demonstrate how it knows the difference between a template name and something that isn't. Patient was here today with normal back pain, and we evaluated the patient's condition, period. Okay, normal back pain there are just words because they're in the context of words coming before and after. Now, normal back pain. So you see what happened is that it called up the template. It knew those words were associated with this text, and it stopped. The cursor was automatically placed by Dragon in this template. Now I'm going to turn my microphone on, and when I'm done with speaking, I'm going to push the next field button that's going to go there. 75-year-old male. Their shoulders. And so the idea, my example, of course, is ridiculous, and apologize for what I probably should say. In any event, the idea is you store text with make that a shortcut. So try it yourself if you have a relatively version, if you have Dragon Medical that is either Practice Edition or Practice Edition 2, you'll be able to do that, make that a shortcut, and use it today. So you create your own templates. But then later on, let me see, I wanted to use that template I created earlier. What the heck did I call that? Well, here's another really key thing. I'll go back to PowerPoint just for reference. You saw next field, and we can put next field defaults in, but I want to continue on here because we will be done within a half hour before 12 o'clock. How do I remember template names? There's a feature called Dragon Sidebar, which you can access by either saying Open Dragon Sidebar or what can I say? So what can I say resulted in this list, and this is my list of templates. So it alphabetizes them, and you see when I make templates, I usually call them normal this or normal that. Well, you can make them anything. They could be called ABC template or ABC whatever. And you see normal, let me see, I said normal back pain, right? So, oh yeah, there it is, normal back pain. So I'd forgotten that template name. So I now know I could use that template, and I see one. Oh, I've forgotten we have one for nerve block. Nerve block. New paragraph. Normal back pain. I'm actually moving my cursor now. I can come back up to start procedure description, so I could have had something at the beginning, something at the end, because there were actually 2 separate templates here. But you get the idea. The what can I say brings up on the screen not only the template names you've created, but also what are the other commands like new paragraph, bold that, underline that, scratch that. There are very few commands. When all is said and done, you've already heard me use most of the ones, or a large number. There are no more than 10 or so commands you'll use frequently. Go to bottom, go to top, new paragraph, make that a shortcut, But the list is not endless. That's the point. This is not an impossible task, and we give you cheat sheets, and you have this online what can I say. So I'm going to return here. What else is really important? So repetitive formatting, you have maybe a SOAP note template that you want to have underlines and bolds and some other formatting in. Store the formatting with your template. So I'll do that now. SOAP note template. Okay, so this one, the formatting is not stored in there. SOAP template. I guess I didn't store the formatting for this. So anyway, you can have this such that you can have this selected and you can say, underline that, bold that. And at this place, I guess I can't do formatting. So if you're in Word or whatever, most Windows programs will allow you to do this automatic, and it will remember the formatting. So when you bring it up, then all you have to do is fill in the blanks. Patient's condition seemed exactly as described by the patient. Evaluated the patient and saw difficulties in the lower back and want to schedule an MRI. We'll have this patient reviewed again in 2 weeks. Schedule MRI, period. See the patient again in 2 weeks, period. New line, 2 period, tab key. Call Dr. Smith for cardiac evaluation. Okay, so again, clinically what I'm saying is dumb and doesn't make sense within the same context of the same patient, but the principles, the things I want to identify here are the templates, the variable fields in the templates, the ability to code a next field, remembering template names. I'm going to add another here, and then we're getting close to the grand finale of productivity. So this is not the grand finale, it comes after. There's a feature that exists in Dragon Medical. I believe if you have version 10.1 Medical or beyond, you can try this today. And that is the search feature. So you can say search website name for clinical condition, like this. Search WebMD for encephalitis. Scratch that. So if I butcher the voice part, which I did, it's not going to work, but here you go. Search WebMD for encephalitis. So it goes out. The search command caused it to choose my default browser, which in my case is Chrome, could be whatever your default browser is. It goes to the website. In this case for WebMD, I could have chosen UpToDate or I could have chosen Google for, and it looks for whatever text. So it found the text, and then I could use my click command to go forward here, or I could use my mouse. So I'll say click encephalitis directory. Click frequently asked questions. Click encephalitis frequently asked questions. So typically it will find on a screen anything that is a link or a button on the screen. So that generally works. Like it would find symptoms, or it would find, if you're seeing it on your screen, it's a link, it will find it. So I'll try one more here. Click Understanding Encephalitis, the Basics. Oh, and it did. Okay, so it actually had done that, and that's just where it takes you on this page. So the idea of the search command, it works beautifully, works consistently. You can be in any program. You can be in Outlook, you can be in EHR. You're on a Windows PC, you say, search Google for map to home, search WebMD for, works great, helps. By the way, Dragon, many people think is a clinical documentation tool. Sure, it is, but use it for your messaging to other staff. Please return the call to this patient, blah, blah, blah. Put your voice into text. The basic idea is Dragon turns your voice into text with a clinical bias and clinical formatting, and it is usable well beyond and in other programs. I don't type many emails anymore. I speak most of my emails. So really useful. All right, so we talked about internet search and now hidden mode. So if you don't use hidden mode, you might listen to this. When I first saw and heard about hidden mode, I thought, what's the big deal? Frankly, I did. I did not know. I didn't understand how this could be used until later on a trainer was with me and explained, no, you don't understand. This is what the issue is. A lot of times it's navigation within an EHR. So you're in one place in your EHR and you're in the process of dictating. We've dictated some stuff here. And now you want to go check out the lab results of the previous progress note or whatever. And then you're going to have to come back and in each place, bring your cursor back, put the text back. So now, instead of doing all those things, I'm going to turn on hidden mode and it's going to start accumulating text. So I just pressed a button on my microphone, which we set for you, and this little box pops up. This is called the dictation box. And now whatever I speak is going to go there. So I can go someplace else in my EHR and go look at the lab results for this patient. And okay, so this patient doesn't have any history, that's fine. Whatever I want to look at, the Coumadin results, and I'll start dictating. So I noticed that previous Coumadin results were getting better, period. Then starting December of 2013, the INR was increasing, period, new paragraph. So again, clinically, I have no idea what I'm saying, but I'm going from here to someplace else in the EHR. We're looking at lab results or whatever, and so I now add some more information and I say lab for CBC came in normal the last 3 times, period. And again, I just am deciding where else I want to go in my EHR. I'm going to come back to my dictation box and I'm going to say transfer text. So, and I'll change this here. Select SOBLAB, the results. So the idea is accumulate text wherever you are and then place the text at a command. So the dictation box in use is called hidden mode. So if you feel like you need to get to where you're going and you're spending time with extra tab keys and clicks and you'd like to be able to just dictate as you go, remember hidden mode. So some other things, one I'm going to mention, network voice profile. This is really important. Some of you are operating where you have multiple PCs or tablets or laptops. That's very common. With Dragon, it's licensed per speaker. You can use it on any number of devices. Out of the box, you can load it 4 times before you get a message. As a reseller, we know what to do with Nuance, turn that off. They're not really trying to prevent clinical use from 15 PCs and 6 laptops. If you really go to multiple locations and you're using it on multiple places, perfectly fine, you're within your license rights. You do have, it has to be installed on each of those PCs. So when it's installed, generally it wants to set up a voice profile. And if you've used Dragon in any version, you know what I'm talking about. Although it used to take an hour, now it takes 3 minutes to set up your voice profile. But then your voice profile learns over time. So what you don't want is 15 different voice profiles on 15 different devices. Solution, network voice profile. There's no extra cost. You just have to know to do it and how to do it. So the way this works is when I store my voice, instead of storing it on my C drive, I tell it the network location. Then that location is accessible to me from any place else on the network. And so I go to another PC, I load Dragon, I tell it to find that voice profile. So now they're all linked together. So whenever I speak, I'm using that voice profile, and whenever I finish, it's storing my updated voice profile there. But really important, it also stores it on my C drive. So what does that mean and why is it doing that? Because the laptop I just used, tonight I may take home. I want to dictate from home, but I'm not connected to my network. So when I load Dragon, it says, I don't find the network, but I do find a voice profile on the C drive, and it uses it. So all well and good. I speak some things. It learns some things about my voice. I go into the office tomorrow. I plug this into the network, and I bring up Dragon, and it says, the version on my C drive is more current than the one on my network drive. Do I want to update the network drive with the C version? Yes. Boom. So it integrates, works beautifully. All it needs is a little knowledge and a little setup. Okay, one more thing I'm going to demonstrate, and then we'll move on and be finished. One area where Dragon has really improved. If you try this in 10.1 or prior, you'll probably not get great results. But what I'm going to do is try and butcher some text. The patient was here today for a difficult exam. So much as I try and butcher, I mean, you can do it in such a way that Dragon won't get it, but pauses and stretching of words and things that even a lot of times if I double speak, that kind of thing, it will correct that automatically. So it's gotten much better at accounting for the fact that we're humans and we don't speak perfectly most days. Okay, so these are some really key things. Templates, select command, make that a shortcut. Setting next field and having next field defaults. What can I say? Remembering template names. Internet search, hidden mode, network voice profile. Those are some really key areas. So what else do we want to talk about today? Very quickly, some settings. When you take Dragon out of the box, Dragon Medical, again, one of the reasons, of course, Dragon Medical is a more expensive product than the free Dragon that comes on your iPhone. The recognition capability of some of the other versions of Dragon are remarkably good. What they don't do is templates and some of these other features, they're not built in. But one key thing you can only get, and it's not PBSI's decision, this is a nuance thing, you cannot use a PowerMic unless you use Dragon Medical. And to me, having gotten accustomed to using this PowerMic and knowing what it means to have these buttons and how I would miss it if I just had a Bluetooth headset and I'd have to figure out how to do everything I do with a button to replace that with a voice command or something, I would say, no, give me that microphone back. So it's settings out of the box. The on and off button is set to push to talk. We changed that. Some people prefer push to talk. That would make my thumb tired. We set a next field and a previous field button. We set up for remote Dragon use. So if you're using Citrix or Terminal Server or from remote locations, the setup of the dictation box and the microphone or the buttons to say open it and transfer text. They're small things. We don't use a lot of the buttons, but the ones we do use, they're important. And then setting up an iPhone or an Android. So I'm the president of a technology company. When I tried to do it, I couldn't do it because it's not Bluetooth, it's wireless. It's using a different thing. It's looking for a different set of information. Oh, it's simple to do if you know how. It's not expensive. Just a little knowledge, really helpful. And then we make sure that all the settings to require the click command are there. So you heard me say click save or click button name. If you set this in such a way, you can all of a sudden say save, the word save, and it'll try and click your save button. So you want to make sure you require the click command, and it's one of the settings, easy to set. So some tips. We do this for every client and review this. Okay, so training. Last couple of moments, what really works, we find one-on-one on-site training. We found so many people who purchased Dragon and never really got it off the ground and never figured out why, and because they never figured out what the key things in Dragon were that they really needed to pay attention to and learn. And so what really works, listening to me today, hopefully that helps you. If you're experienced with Dragon and you just need us a bit of information, great. If you have never seen Dragon before and you got off the phone and had Dragon in your hand, would you know how to implement all these things? What we find, a trainer in there in your office behind you, watching you, you're doing the work and trainer's telling you what to do and taking you through a process, that works. We always include a support person in training. We've learned this over the years that if you don't have anybody to turn to in your office and you can't think through workflow issues. And we really have found this to be important, 2 sessions per physician. So we schedule one a couple weeks apart. And the reason we do it is accountability. So the accountability is experience has taught us that the first training session can go beautifully, but busy providers, change is not that easy. You want to do the next thing the fastest you can, and you don't really remember how to use that Dragon quite so well yet, so you just do it the old way, and all of a sudden 2 weeks later, your description of Dragon is, I don't really know if it's working well for me. So first training session, the trainer says, I'm scheduled to be back here 2 weeks from tomorrow or whatever the day. Our agreement between now and then is you're going to use Dragon for at least 2 patients a day or at least half hour a day. You must get it into your system. Once you do that, a couple weeks from then, that second training session is going to be really productive. You're going to be very positive. You're going to see that it's working, but you need to clean up. What was that make that a shortcut thing about? So on-site training really works. We can do it by web, and it can work okay, but you're going to spend the money for this product, put it in use effectively. Okay, so how much does Dragon cost? $1,899 with a PowerMic. And these are set prices, as no authorized reseller is allowed to publish a price that is more than $50 under this. So you can't find it cheaper on the internet. But so it's $1,599 without the PowerMic, $1,899 with the PowerMic. We discount $100 a copy for every practice who's had a webinar attendee. So anyone in your practice who purchased a copy of Dragon within the next month, discount. And then a couple of on-site training sessions. For some of you, that would be $150 each. For some of you, it'd be $200. It just depends on your location. And then some other setup services that we can do. But most of the stuff we do after this, including the installation of it, is included. So you're going to spend, call it $2,400. In the next 5 years, you're going to buy an upgrade that usually come out every 3 or 4 years for $400 or $500. So you're going to have spent per speaker $3,000 over 5 years. Simple math, divide by 60 months. You have spent $50 a month. It's an asset like you purchase a copier or a PC where over time that's really your net cost. You're just paying for it up front. At that kind of cost, $50 a month, the productivity gain is so worth it, and the speed up of turnaround time between when you dictate and when it's returned to you. So that's the basic economics. We'll do free quotes, free demonstrations for any practice. So if you'd like to schedule follow-up, a web demonstration or an on-site demonstration for you or partners or whatever, feel free. We don't charge for these things. And I want to thank you for your attendance. And if there are follow-up questions, when you log out of the webinar, you will be presented with a small box with a couple of feedback questions. We'd appreciate your feedback, but if you have questions you'd like follow-up, we're happy to help.